Coming up, we'll be on location at Kalyani Eye Care in Hanover, Maryland, discussing the latest advances in vision care and how they can help improve your vision with one of this area's top ophthalmologists, Dr. Sachin Kalyani. Dr. Kalyani completed his residency from the University of Maryland in ophthalmology, and he completed his fellowship from Johns Hopkins Wilmer Eye Institute and is widely recognized as one of this area's leading ophthalmologists. Welcome, Dr. Kalyani. It's a pleasure to have you on our program.
Thank you for having me.
We have a lot to talk about. We have a couple of patients that are going to be joining us a bit later. But I wanted to begin, if I may, Doctor, by having you tell us about some of the latest treatments that are available in vision care and that you offer here at your practice.
Sure. Ophthalmology, one of the most exciting things about it is that there's always advances in our field. One of the recent advances has been in cataract surgery. Although it was a common misconception that cataract surgery was done with lasers, it really has not been done with lasers until just a few years ago. And that's one thing that we've been offering at our practice, to have laser-assisted cataract surgery. Using the laser helps improve the precision and the accuracy of some of the steps of the surgery. It just allows for better, more reproducible outcomes after surgery.
All through the advancements in technology,
yes.
right?
Yes.
Everything is not more precise now through this laser technology?
It is. It's more precise, and we can customize it for each patient that undergoes a procedure. So it's a very individualized procedure.
Well, that's certainly good to know, Doctor. Now, what types of problems does this correct? What are we looking at as far as folks out there watching right now?
Sure. So patients who need cataract surgery usually have some common complaints with their vision. Blurry vision or hazy vision is often a common complaint. Oftentimes glare is another big complaint with patients. Many patients will come to me and say that their biggest complaint is that they have trouble driving at nighttime. With the headlights oncoming headlights really bother them, and they've had to either stop driving or really limit their driving at nighttime. Yeah. These are all signs of cataract formation and can be treated with cataract surgery.
And who would you recommend as far as a good candidate that could benefit from these laser treatments as far as cataracts go out there who may not know that they're, have cataracts?
Sure.
As far as early symptoms, who can really take advantage of this?
Sure. A lot of the symptoms are, if you feel like your vision's just not quite as good as it used to be, your glasses have to be adjusted every few months. You need to get a new pair of glasses. You have other symptoms as far as having trouble seeing road signs or nighttime driving becomes difficult. Those are all signs that you could have cataract formation. And that's when you should be seen by a specialist to see whether your vision symptoms are from cataracts or is it from something else.
Very interesting. And how long does the procedure take as far as the laser treatment to take care of the cataract problems? And again, I throw in the disclaimer that I'm sure it varies a little bit depending on each particular patient, his or her situation, but in general, what is a patient looking at?
Sure. The actual surgery itself is anywhere from 15 to 20 minutes. Sometimes it can be up to half an hour long. Again, it does vary for every patient. But the actual time that you're at the surgical center is probably about 2 hours or so, because you have to show up a little bit ahead of time to get the preoperative care, and after the surgery you're in the recovery room for about 20 minutes before they send you back home.
So you can go back home the same day?
You do go home the same day, yes.
Okay. And what kind of results can we expect from these laser treatments, Dr. Kalyani?
Sure. The main goals of the surgery is to improve the vision. We try to reduce the dependence on glasses as well, so we can try to correct a lot of the prescription that you might have in your glasses by doing cataract surgery. Again, we can reduce the dependence on glasses. We can't always guarantee you don't need glasses at all, but oftentimes a prescription is a lot less after cataract surgery. There are other factors. If you have other underlying conditions such as glaucoma or macular degeneration or diabetes, that can of course affect the vision after surgery.
Yes.
But we never do surgery unless we feel the benefit of it outweighs the risk of it.
We're now going to meet a couple of patients of Dr. Kalyani and Kalyani Eye Care. Welcome, Judy. It's a pleasure having you on our program.
Oh, I'm very glad to be here.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, Judy, I'd like to begin, if I may, by having you tell us what brought you to Dr. Kalyani and Kalyani Eye Care?
My eye doctor said it was time for me to get my cataracts removed. And she recommended Dr. Kalyani.
Oh, so then you came here, and what happened?
And I had my first visit, and he checked everything out, and he set me up for surgery.
All right. And how long did the surgery take, Judy?
15 to 20 minutes. That was it.
That's it?
That's it.
That's great. And then how do you feel today? How are the results from the surgery?
Oh, great, great. The next day, I came back in for a checkup and felt good. Everything was fine. They just give you a local anesthetic, so it's no problems.
So you
as
go
far
home,
as any.
You go home right after the surgery?
Yeah, go home right after the surgery, and everything's fine. The next day, no jumping up and down, because I do like to exercise, so I had to cut that out for a little bit. But other than that, it was fine.
And as far as your vision in that eye, how is that now?
Great, wonderful. I can see colors more clearly and more bright, and distinguish between blue and black, and it's fine.
Well, I'm happy to hear that. And before we let you go, Judy, for all the folks watching out there, any additional thoughts you'd like to share with us?
No, it's they have a wonderful staff. They make you feel very welcome, and he's a great doctor. He puts you right at ease, and I had a wonderful experience, and I highly recommend him.
On that note, we'd like to thank you for joining us, sharing some of your experiences, and being a guest on our program.
You're very welcome.
Welcome, Karen. It's wonderful having you on today as well.
Thank you. It's good to be here.
Our pleasure. I wanted to begin by asking you, Karen, if you can please tell us what problem or problems were you experiencing that brought you here to Dr. Kalyani?
Originally, it was for routine, checkup. I hadn't had one in a long time, and I had the beginning of cataracts. And as the one in my left eye got worse, Dr. Kalyani recommended that I have it removed.
Okay.
And so I went through that, and
you had the procedure to remove your cataracts as well, just like Judy did.
Yes, I did. Yes, I did.
And
yes.
how long did your procedure take, Karen?
Just about 15, 20 minutes.
That's
it was easy in and out. Yeah, very easy. And then later on, I had cataract in my right eye that came on. It seemed like it came on rather suddenly to me, and Dr. Kalyani was able to get me in the office that afternoon when I had problems, and schedule a surgery very quickly, and I was able to see again. I have a problem in my left eye that I don't have full vision, so getting the right eye done was really critical to me.
Yes, indeed.
Yes.
So you actually have had cataracts in both eyes removed by Dr. Kalyani.
Yes.
And I take it because your left eye has been inherently weaker for basically, I take it, for many years, is that right?
Since I was 6.
Since you were 6?
Yeah,
so your right eye was very important
Extremely.
to have at full vision.
Right.
And that's what Dr. Kalyani made possible through the procedure.
Right.
And before we let you go as well, Karen, for all the folks watching, what would you tell them as far as your overall experience with everything here?
It was excellent. Everything was explained to me. I knew what was going to happen. I knew that I could call on Dr. Kalyani if I had any issues. With follow-up, the staff is great. It's a great experience.
Well, on that note, we'd like to thank you as well for joining us and being a guest in our program. Thank you, Karen.
Thank you very much.
Our pleasure. You did some great results. Both Judy and Karen very happy with the treatments and their whole experience here with your practice.
Well, thank you.
Now, as far as follow-up visits go, I know they mentioned you generally recommend them coming back a few times within a few weeks and even the first month or two. But as far as a little bit more on a long-term perspective, do you recommend them coming back maybe a year later or 6 months later as well, just to see how things are?
Sure. After the surgery, we usually do see them the day after surgery, about a week later, and then about 3 or 4 weeks after surgery, just to make sure everything is healing properly and that that there's no signs of infection or other complications. After they're out of that recovery time, usually if they've been referred to me by another physician, I'll often have them just follow up with their regular eye doctor that they have been seeing for many years. If it's somebody who does not have a regular eye doctor, I usually I would follow them and see them about a year after surgery just to make sure everything's okay. Yeah. But of course, if there's ever any issues, I always tell them to call me and come in between.
Yes, indeed, and they both mentioned that. You're right there for them, obviously you and your whole staff. And we're literally out of time, Dr. Kalyani, but I wanted to ask you before I let you go,
Sure.
You and your practice, Kalyani Eye Care here in Hanover, Maryland, and Anne Arundel County, Maryland, have certainly established a reputation for excellence in patient care and eye care, obviously. I just wanted to ask you what you feel helps separate you and your practice apart from some of the others.
I think what we strive for every patient is, from the time they walk in the door, is to have our friendly staff meet with them. I also find it very important that I feel as a doctor I should talk to the patient myself and examine each patient, personally examine each patient and go over treatment options with them.
Yes.
I like to get to know the patient and their family and their expectations and their lifestyle needs, because all of that does play into what kind of treatments we would offer and what would be the best for them.
Well, on that note, we'd like to thank you, Dr. Kalyani, for joining us, being a guest in our program. It was our pleasure having you on.
Thank you. Thank you for having me.